Hello, my name is Alexander LaFontaine. Today we'll be going through how to do different flexibility assessments, focusing on the lower body. So we have the hip, the knee, and the ankle. The first two assessments that we're going to do is going to focus on the range of motion for the hamstring. So looking at the right leg, first thing we want to make sure is the left leg stays flat on the actual bench. So we can help with that by putting the hand down, kind of keeping it down. Second thing we want to do, we'll tell the client to straighten the right leg, since that's the one we're going to be assessing. We're going to tell them to squeeze the quad. Now the main thing we want to look for is that hip, as we want them to bring the leg as high as they can, all the way until the hip, like right before it comes off the ground. So what we'll have to do now is we're going to flex the hip, so we're going to bring the leg up as high as they can, still maintaining the knee completely straight. We have, see, the hip is low. Then we want to now measure the angle of the actual hip itself. So if we're looking here, going through the actual femur itself, we want to look, and we're looking at, let's see, 297. Okay, perfect. So we'll bring it down. Now the main thing we're looking with this assessment, because the knee is in full extension, that means the limiting portion is going to be at the hip, the proximal area, so we're looking more at the proximal hamstring, the semitendinosus, the semimembranosus, and the bicep femoris with the long head. And the main thing we want to make sure again is the hip itself, the butt stays on the actual surface the whole time. We don't want it to come up, which means some type of posterior pelvic tilt. We want it to stay neutral. And then again, the leg that's not being assessed stays down, so we do it by holding it down. And then the other leg with the knee in full extension, bringing it up as high as we can. So we're going to do the same thing, get a measurement on the other side. So you'll tell the client, so straighten this leg. Now bring it up as high as you can, holding that position, good. We'll get the measurement again at the femur itself. Perfect. So we have our measurements for that. Next, we're going to do the hamstring, but first one we did proximal. Now we're going to be looking at the distal portion. So for this one, we want to make sure we have our goniometer with us, because the main thing is the hip needs to stay at a 90-degree angle the entire time. So what we'll have to do is have the client bring the leg up, so bring it up. Again, we're looking for 90 degrees. So we're gonna make sure that that angle, see, just about 90. Okay, perfect. Once they are there, what you want the client to do is to straighten that leg that's being assessed all the way until they can't anymore, while maintaining that 90-degree angle. Come back down. So again, you want to start at the 90, make sure it's tight. Okay, now slowly extend the leg until you can't anymore. Okay, so we're still, around 90. And then now we look, we're able to get about 111. Okay. Now the same thing we're going to do on the other side. So this will be the leg that we want to make sure we keep straight. This leg, the assessed leg, we're going to bring it all the way to 90-degree angle. Again, we'll get the goniometer. We'll make sure we're at 90, just about. Okay, and then once we are at 90, let's straighten that leg. Okay, holding, again, making sure the hip stays on the ground. And then we're going to look at that angle. Okay. Perfect. Now relax. And the reason again we want to do the active knee, it's called active knee extension, is because now that the knee or the hip is at 90 degrees and we're looking at how much extension that the client can do, we're looking at the distal portion of the hamstring. So again, we're looking at semitendinosus, membranosus, and the bicep femoris, but looking more at the long head now, since that focus is on knee flexion. And the reason we're looking at those three for the hamstrings because they do cross the hip and the knee joint. So we want to make sure that we're able to assess both proximal hamstring as well as the distal hamstring. The next assessment we have is the bilateral hip and knee flexion. Now for this one, we're going to be looking at the angle of hip flexion. Again, the main focus we have is looking at the hip, that the butt does not come off the ground entirely, because we want to make sure there's no posterior pelvic tilt and instead at the pelvis stays in a neutral position the entire time. Now, we know that the hamstrings and the glutes are hip extensors. We were able to focus on the hamstrings because we're looking at the angle of the knee flexion, knee extension. This time, because the knees are going to be flexed with the hip, we are reducing any tension from the hamstrings, and instead now we're able to focus on the glute max. So this is more to assess any tightness in the glute maximus. So what we're going to do is we're going to have the client bring their knees all the way to their chest. We're going to hold one at a time. A few things we want to make sure is that there's no internal external rotation, so we want to keep it sagittal. Again, we are looking at the hip itself, and we want to be able to go as much as we can. Where you see now the pelvis is starting to come up, we want to keep that position, and we are looking at the angle of hip flexion. So then we go by the side of the femur itself to get an idea of what the foot angle is. Okay. Then with this one, luckily, they're able to hold the position, and then we can get the angle on both sides. Again, looking at that hip, making sure the glute stays on the ground the whole time. Assessments, what we're looking for are for the hip flexors. So again, the main thing, just like we did with the bilateral hip flexion, is we want to make sure the actual pelvis stays neutral. With this one, we do want to make sure the client is all the way back so their butt is essentially off the bench, allowing us to be able to see what their hip flexion range of motion with hip extension. So what we're going to do is we're going to have the client hold one of their legs, so hold the right leg, the left leg, and then we're going to have them bring their other leg straight up, and then they're going to come all the way down, maintaining the leg straight, and I'll explain why. All the way down, all the way down, all the way down. Perfect. Now, what we're looking at is this range of motion here. So looking at hip extension. So we're looking here again, we're looking at the femur. Good. Perfect. Now we'll bring the other leg up, and then the same thing. We're going to have the client holding the other leg. We'll have that assessment leg, have it straight. We're going to have them bring it down all the way, all the way, all the way. Good. And then we'll get the measurements here. Again, we're looking at the actual femur itself. Perfect. Now we'll bring the leg up. Now the main reason we do this assessment with the knee in full extension is we are looking at the Iliopsoas. So we have the hip flexor muscles that only cross the hip itself, but we also want to make sure we do the other hip flexor muscle, also known as the Rectus Femoris, how that muscle itself, it is a quad muscle, so it does work in the extension, but it crosses both the knee and the hip joint, so it is also known as a hip flexor muscle. So the reason that we do, again, straight is for the Iliopsoas, and for this one, we're going to have the knee bent, which is now going to put strain or stress on the actual rectus femoris because, again, it crosses the hip and the knee. So what we're going to do for this one is we'll have the client hold the non-assessed leg. So I'll have you hold the left leg. Now for this one, we're going to have the client bring the leg down. Same thing, we're looking at the hip itself, but now we want to make sure that knee is bent. So again, we're looking using the actual femur itself. Looking at the angle of the femur. Okay. Perfect. And then we'll bring the leg up. We're going to do the same thing on the other leg. Making sure, as always, hip stays on the ground. We're going to bring that leg while it's in flexion, the knee all the way down, like it's dangling off, and then again we're looking at the actual femur and getting the measurements from there. And we want to make sure we're trying to see is not any range of motion in the hip flex, like in hip flexion, but more of a hip extension, so that we see there is no tightness in the actual hip flexors themselves. All right, now we're going to be looking at the ankle itself. So when we talk about the calf themselves, we're talking about the Gastrocnemius and the Soleus. So what we have here is a standing ankle dorsiflexion screen. What you want to make sure is your client has one foot right behind the other. Again, we're not going to make sure it's not internally or externally rotated, but we're keeping everything in the sagittal plane. Now what we want to make sure they do is, as they start flexing the ankles, there's going to be some form of knee flexion. We want to make sure that they're not flexing the hip to the point where they're like touching the ground with their arms. We still do want them to stay a little upright. So all I have to do is start bending at the hip knee, nice and easy, nice and easy. Not this one as much. Good. And we want to make sure the heel stays on the ground the entire time. And then now when we're looking at the angle, we want to make sure we have it by the shin bone. That'll give us a good idea of what measurement we have. Okay, so 136. Okay, perfect. Let me just write that here. And then now to do the other side, we're going to have the client rotate the other way, facing the other way. And now this time, we're going to have, we had the other foot, so we're going to switch them again. So we're looking to make sure everything's in sagittal plane. So bring that toe a little more so it's touching the heel just by the butt of it. So bringing the foot a little closer in right there. Okay, perfect. So again, you're going to have the client start bending this knee, and as they do, there's going to be a little bit of knee flexion on the other side, a bit of hip, but we want to make sure the hip not too low, is that we go all the way to where the heel stays on the actual ground itself. We don't want the heel to be elevated. And then again, we go all the way to the shin, we get our calculations, perfect. And then we can have them stand up. Now the big difference that we're looking between this assessment compared to the other one that I'll be showing you is, given there is knee flexion and we know that the gastroc crosses the ankle and the knee itself, by inducing at least some degree of knee flexion, we reduce the tension from the gastroc, so we're able to then realize, okay, this dorsiflexion screening with the knee inflection targets the soleus. And then the next one that I'll show you is we're going to start targeting just the gastroc itself. Now for the gastrocnemius, so again, we look, it crosses the ankle and the knee itself. So to be able to do this assessment, which changes it from the soleus, is instead of any degree of knee flexion, we want the knee to be in full extension. So what you would have is your client, so we're going to assess the right foot, have your client with the left leg step forward, almost in a lunge type position. They can bend the hip and the knee of the front leg, but the main thing we're looking at, again, is the back leg. So we want to make sure the back foot is not internally, externally rotated, but is straight and stays in the sagittal plane. Once they're in that position, you're going to have your client start bending the front leg all the way to the point right before that heel. So see, heel slightly comes up, so we're going to have them come right back down, right before the heel comes off the ground. And then the angle that we have with the knee in full extension is what we're looking for. And again, we're looking at the shin itself to get an idea of what the measurements we have. Okay, we got the first one. So then now you'll have your clients bring both feet together, and then they're going to do the same thing on the other side. So you're going to have the client now bring the right leg forward almost in a lunge position. Again, we want to make sure the foot, there is no external or internal rotation. You want to keep it straight. Once the client has good balance, then let's have you start bending the front leg, coming all the way forward. And I see the heel starting to come up, so we want to come a little bit back. So come a little bit back, just a right there. And then again, we're going to start looking at the angle all the way by the tibia itself. So we're looking here, okay, we got a good number. And then we want to put the number in, and then after that, we're going to have the client come back to relax. And then there we have the 7 assessments. So again, just to recap, we were able to see both the proximal and the distal hamstring. We looked at the glute max. We looked at the rectus femoris and the iliopsoas. And then we looked at the gastrocnemius and the soleus. So we looked at the hip, the knee, and the ankle, and the different joints along to see what was tight and things of that nature. Thank you.
At around timestamp 5 minutes and 1 second, when we're talking about active knee extension, I accidentally said that it focuses on the bicep femoris long head, when in reality it's the short head, as it's the bicep femoris short head that focuses on knee flexion. So when we look at the active knee extension, and we're essentially trying to get the client to fully extend the knee, the limiting factor there would be the bicep femoris short head in conjunction with the semitendinosus and membranosus, as again, the hip is at 90-degree flexion, so there's still going to be focus on the entire hamstring as the whole hamstring crosses the hip and the knee joint.